My name is Janet. I will be talking about HIV AIDS. First of all, what is HIV AIDS? HIV stands for Human Immunodeficiency Virus. It is the virus, if not treated, that can lead to AIDS, which means acquired immunodeficiency. Unlike some other viruses, the body cannot get rid of HIV completely, even with treatment. So once you are infected, you have it for life. HIV attacks the body's immune system, specifically the CD4 cells, T cells, which help the immune system fight off infections. Untreated HIV reduces the number of CD4 cells, T cells in the body, making the person more likely to get other infections or infection related cancers. Over time, HIV can destroy so many of these cells that help the body fight off infections and diseases. These opportunistic infections take advantage of a very weak immune system and signal that the person has AIDS, the last stage of HIV infection. HIV can be contracted through, but not limited to, the following: sexual contact that involves semen, pre ejaculatory fluid, vaginal fluid, or blood. Direct contact, particularly through sharing of needles, especially among drug users. It can also be contracted through blood transfusion, accidents in healthcare settings, or certain blood products, although extremely rare in the United States. Mother to baby, before or during birth, or while breastfeeding through breast milk, and so on. According to US Centers for Disease Control and Prevention, CDC, more than 1.2 million people in the United States are living with HIV infection. It is estimated that almost 1 in 8, 12.8%, don't know they are infected. From 1981 to 2013, an estimated 1,194,039 people in the United States has been diagnosed with AIDS. Of those, 658,507 have died. An estimated 50,000 new HIV infections occur in the US each year. At the end of 2011, 23% of all people living with HIV in the United States were women. The vast majority of newly diagnosed HIV positive women contracted the virus through heterosexual sex. In 2010, gay men and other men who have sex with men, MSM, accounted for 78% of newly HIV infections among men and 63% of all new infections, although they comprise only 4% of the US male population. African Americans accounted for almost half of new infections, 44% in 2014. Although they comprise only 12% of the population, the rate of new HIV infection among black women in 2010 was 20 times that of white women and nearly 5 times that of Hispanic women. In 2010, 31% of all new infections occurred among people aged 25 to 34, followed by individuals aged 13 to 24 at 26%. The treatment of HIV depends on the stage of the disease. In general, the goal of treatment is to prevent the immune system from deteriorating to the point that opportunistic infections become more likely. Highly active antiretroviral therapy, HAART, is the principal method for preventing immune deterioration. The treatment fights the HIV infection and slows down the spread of the virus in the body. HIV treatment is usually permanent and lifelong. HIV treatment is based on routine dosage. Pills must be taken on a regular schedule every time. Common side effects can be, but not limited to, the following: nausea, fatigue, diarrhea, skin rashes, moodiness, alterations in the adipose fat tissues, birth defects. There is also another medication called PEP, post-exposure prophylaxis. This medication is for an individual that believes that they have been exposed to the virus within the last 72 hours, 3 days. The treatment should be taken as soon as possible after contact with the virus. PEP is a very demanding treatment lasting 4 weeks. It is also associated with unpleasant side effects: diarrhea, malaise, nausea, weakness, and fatigue. Although antiretroviral medications require adherence rates of 95% or greater to achieve virologic suppression and derive immunological benefits, more than half of antiretroviral therapy patients do not achieve adherence in this optimal range. In the USA, suboptimal adherence, in addition to differences in access to care and treatment delivery, are cited as factors accounting for disparities in HIV treatment outcomes experienced by African Americans and other population groups disproportionately affected by the HIV/AIDS epidemic. Numerous studies have found high rates of mental illness and substance abuse among people living with HIV/AIDS. Research indicates that HIV positive individuals with multiple diagnoses, for example, mental health disorder and substance abuse, are more likely to be compliant with their medication regimen, suffer from adverse effects from HIV/AIDS, have quality of life, have a lower quality of life, and have higher rates of HIV/AIDS mortality and morbidity. Further, individuals who are duly diagnosed with both mental illness and substance abuse report a lack of social support, require more intensive assistance in meeting basic needs, and are less likely to attend scheduled sessions with healthcare providers. Also, stigmatization and discrimination plays a vital role in the life of individuals living with HIV/AIDS. So what is stigmatization? According to Free Dictionary, stigmatization is the assignment of negative perception to an individual because of perceived difference from population at large. Discrimination, on the other hand, a term almost interchangeably used with stigma, refers to an action of noting difference. It says, discrimination emerges from attitudes and behaviors that others employ to keep the stigmatized person outside the regular normal functions. Discrimination plays itself out as a social seclusion or isolation, rejection, denial or refusal of services, and breach of confidentiality. Discrimination due to fear of contracting HIV/AIDS may lead to rejection by family and community. Absent or reduced confidentiality, refusal of services such as education, employment, and adequate or improper health care service delivery. Such discriminatory actions may lead to denial of essential care, resulting from lower disclosure of HIV status, reduction in prevention efforts, increased rates of disease progression due to delayed initiation of medical treatment, and even early death. Studies have also shown that HIV infection significantly impacts people's psychological and sociological well-being. Rates of current depression among persons with HIV has been estimated to be 2 to 5 times higher than rates of depression among people who are HIV negative, and rates as much as 4 times higher among women with HIV than women without HIV. People with HIV meet the criteria for generalized anxiety disorder at a rate almost 8 times higher than people without the disease. People with HIV/AIDS also report feelings of self-doubt, self-consciousness, negative expectations about interpersonal interactions, and feelings of hopelessness and despair. Yes, there is currently no vaccine or cure for HIV/AIDS, but then it is not a death warrant. Early testing and HIV antiretroviral treatment can improve quality of life, extend life expectancy, and reduce the risk of transmission. Thank you.